PCO is changing into MEPS, metabolic endocrine polycystic syndrome. But guess what? Changing the name does not change the pathology. It is the same pathology, but we are looking at it from a different perspective. Women are still struggling with irregular period, acne, infertility, hair loss, insulin resistance, and long-term metabolic complications. The reason behind this new terminology is that the old name PCO focuses too much on the ovaries, while we know now that the condition is actually a whole body metabolic and hormonal disorder. In fact, many women are diagnosed with PCOS do not even have ovarian cysts. The real issue is often lying on the insulin resistance, the hormonal imbalance, inflammation, and metabolic dysfunction. So, how do we diagnose the PCO today? The current guideline relies on the Rotterdam criteria. Usually, the diagnosis requires 2 out of 3 findings. First, irregular or absent ovulation, which occurs as irregular menstrual cycle. Second, signs of excess male hormones like facial hair growth or scalp hair thinning. And third, the appearance of polycystic ovary on ultrasound. But doctors must also exclude other hormonal disorders before making the diagnosis. And one important update is that in the teenagers, ultrasound alone is not sufficient for the diagnosis of polycystic ovary, because the ovaries in adolescents, even if they have multiple cysts, they may be normal. So today the management is not just about prescribing the birth control pills, but modern treatment focuses on the root cause, especially the insulin resistance and the metabolic health. Lifestyle intervention remains the cornerstone, and healthy nutrition with regular exercise and resistance training with good sleep and reducing the stress. Even losing 5 or 10 kilograms or 5 or 10% of your body weight will help regulate the menses and alleviate the symptoms. Some patients may benefit from new modern medications like semaglutide and tirzepatide in line with the classical metformin. And obesity and insulin resistance is very important as a nominator for the success of the treatment. We have to treat the root cause, and whether we call it PCOS or PCO or MEPS, the mission remains the same. Earlier diagnosis is the most important, and it is a cornerstone in alleviating the symptoms. And the treatment of the fertility issues is individualized based on the case itself. Please share the video with the others. Thank you.